There's a drug that makes your brain think you just ate a Thanksgiving dinner. Your stomach feels full, your cravings disappear, and you forget to eat. I'm talking about semaglutide. You probably know it as Ozempic or Wegovy. It's been called a miracle, a shortcut, even cheating. But here's what nobody is telling you. What happens when you stop taking it? And is the weight loss actually real? Or is there a dangerous catch? Let me explain exactly how this works in the next 10 minutes. What is semaglutide? Semaglutide belongs to a class of drugs called GLP-1 receptor agonists. That's a mouthful, so let me break it down. GLP-1 is a hormone your gut naturally produces when you eat. Its job is to tell your brain, hey, we're full, stop eating. But here's the problem. In people with obesity or type 2 diabetes, this signal is weak. It's like a text message that never delivers. Semaglutide is a synthetic version of that hormone, but it's stronger, much stronger, and it stays in your system for days instead of minutes. Originally, this drug was developed for type 2 diabetes under the brand name Ozempic. Doctors noticed something strange. Their patients weren't just controlling blood sugar, they were losing dramatic amounts of weight. So the manufacturer created a higher dose version called Wegovy, and in 2021, the FDA officially approved it for chronic weight management. Since then, chaos. Demand exploded, shortages happened, and now everyone from Hollywood celebrities to your neighbor is talking about it. How it works in the body. Let me walk you through exactly what happens inside your body when you inject semaglutide. Number 1. Your brain changes. Semaglutide crosses into a region called the hypothalamus. That's your appetite control center. The drug activates receptors there that tell your body you're full. Not kinda full. Thanksgiving's stuffed full. Number 2. Your stomach slows down. Normally, food moves through your stomach in a few hours. Semaglutide slows this process significantly. Food sits there longer. You feel physically full for 6, 8, even 12 hours after a small meal. Number 3. Your cravings disappear. This is the part people don't believe until they try it. The constant food noise. Thinking about lunch while eating breakfast. Craving sugar at 10 p.m. Semaglutide turns that volume down to 0. One patient told me, I used to think about food 50 times a day. Now I forget to eat until 3 p.m. Number 4. Blood sugar stabilizes. The drug tells your pancreas to release insulin only when blood sugar is high. This prevents crashes. And when your blood sugar level is stable, you don't get those urgent hunger spikes. Real results. What to expect. So, what kind of results can you actually expect? Let me give you the real data, not the TikTok hype. In a 68-week clinical trial for Wegovy, the average participant lost 15% of their body weight. For a 200-pound person, that's 30 pounds. But here's the breakdown week by week. Weeks 1 to 4. You start on a low dose, 0.25 milligrams. This is just to get your body used to it. Most people feel mild nausea. Some feel nothing yet. 0 to 5 pounds lost. Weeks 5 to 8. Dose increases to 0.5 milligrams. Appetite suppression kicks in. You'll notice smaller portions satisfy you. Average loss, 1 to 2 pounds per week. Weeks 9 to 16. This is where it gets real. Dose increases to 1.0 or 1.7 milligrams. Cravings disappear. You might forget meals. Weight loss accelerates to 2 to 3 pounds per week for many people. Week 17 and beyond. Maintenance dose of 2.4 milligrams. This is the therapeutic level. Your body has adjusted. Side effects decrease. Weight loss continues but slows to a sustainable 1 to 2 pounds per week. Now, let me be honest about the side effects because the internet doesn't talk enough about this. Risks, side effects, and downsides. About 80% of people experience some side effect. The most common? Nausea, especially in the first month. It's worse if you eat greasy or fried foods. Some people vomit. Some people get severe constipation, or the opposite, diarrhea. But here are the 3 downsides nobody talks about. Downside number 1, muscle loss. When you lose weight rapidly, up to 40% can come from muscle, not fat. Less muscle means a slower metabolism, which means when you stop the drug, the weight comes back faster. You have to strength train on this medication, non-negotiable. Downside number 2, rebound weight gain. Studies show that within 1 year of stopping semaglutide, most people regain 2/3 of the weight they lost. Why? Because the appetite suppression disappears. The food noise comes back. And without lifestyle changes, old habits return. This is not a cure. It is a treatment. Most people need to stay on it long term, just like blood pressure medication. Downside number 3, the cost. Without insurance, Wegovy costs between $900 and $1,400 per month. Ozempic is similar. Many insurance plans don't cover weight loss drugs, so people are paying out of pocket or finding alternative sources. Which brings me to my next point. Who should not take semaglutide? This is the most important section of this video. Semaglutide is not for everyone. Do not take semaglutide if 1. You or a family member has had medullary thyroid cancer or MEN2. Animal studies showed thyroid tumors. Human risk is unknown, but serious enough for a black box warning. 2. You have a history of pancreatitis. Semaglutide can cause inflammation of the pancreas. This is rare but life-threatening. 3. You are pregnant or trying to become pregnant. The drug should be stopped 2 months before conception. 4. You have a history of diabetic retinopathy. Rapid blood sugar improvement can worsen this eye condition. 5. You are looking for a quick fix without changing habits. If you take semaglutide, eat junk food, and never exercise, you will lose weight, but it will be muscle, and you will regain it all. This drug is a tool, a powerful one, but it is not magic. Conclusion and call to action. Here's my honest take. Semaglutide is genuinely one of the most effective weight loss drugs ever created. For people with obesity or diabetes, it can be life-changing. But it has real risks, real costs, and it doesn't work forever unless you build sustainable habits alongside it. If you're considering semaglutide, talk to a real doctor, not a telehealth service that asks 3 questions. Not a med spa, a doctor who knows your full medical history. Now I want to hear from you. Have you tried semaglutide? Are you considering it? Or do you have questions I didn't answer? Comment below. I read every single one. And if this video helped you understand semaglutide better, hit that like button and subscribe for more deep dives on health topics that actually matter. Thanks for watching.